So today I'm doing a video on different types of miscarriages and pregnancy loss. This is a new year and I want to put it all, like all the negativity behind me and the bad parts, and only think of the good. But I also still want to raise awareness, and see, my losses are always a part of me anyway, so that thinking of it isn't as such bad. I want to raise awareness and help women. So yes, there is lots of different types of miscarriages and pregnancy loss, unfortunately, and a lot of them aren't even heard of or known about, especially the ones I went through. But I'll go through them from like the earlier ones to like pregnancy complications that lead to losses. So the first one I'll do is a chemical pregnancy, and I'm going to be quite brief on most of them, apart from a few, because a few of them you have to go more in detail. A chemical pregnancy is a very early miscarriage, and it normally happens around 5 to 6 weeks. It's a very early one. Basically, the egg fails to survive. Normally it's classed as a chemical because you'll only have the missed period or the positive pregnancy test to show that you was pregnant, because then you'll miscarry before you even get a scan. So yeah, that's a chemical pregnancy. The next type is first trimester pregnancy, which is usually within the first 3 months, and 3 and 4 miscarriages usually happen during this period. And usually, not that it helps, is because of problems that with the baby. So if you miscarry because of abnormalities or things to do with that, so that can be like a chromosome problem or a placental problem. Risk factors for that is obesity, smoking, drug misuse, caffeine, alcohol. Not that if you did any of these it's your fault, but this is risk factors. It basically raises the risk of you having a first trimester loss. Like, not caffeine as in any caffeine, that's a certain amount of caffeine over the amount. I think with alcohol it's a certain amount as well. It is. So yeah, don't worry if you've had caffeine, or because you're allowed a certain amount. The next one is a blighted ovum. I think that's how you say it. This is where a fertilised egg attaches in your womb, but like the placenta can grow, but the baby will never grow. There's something wrong with the baby, so it won't grow, or there's something that happened to it. So then I think you always miscarry. It's like the chemical. Before you even have a scan, there won't be any baby at all. So that is another form of miscarriage. And most of the time, actually, you'll have a scan, but there'll be no baby. Basically, you'll be a sac because the placenta still develops, and because it's still attached to your womb, you'll still be having the symptoms. So you won't know until you have your scan, or if you miscarry before the scan, that it was a blighted ovum, and they'll tell you when you've had it. And if there's no sign of an embryo in a certain size, then yes, that will be classed as a blighted ovum. The next type of loss is missed miscarriage, which I actually was misdiagnosed with first, the second time, my second loss, before I was told I had a molar. It's basically usually in the first trimester, which your body won't recognise that you've had a miscarriage. A miscarriage is classed as a silent miscarriage because basically, like I said, your body doesn't recognise that you've lost a baby, and you'll still be having all the symptoms and the sickness, and basically the ultrasound will tell you your baby's died or there's no baby there. And mine, the baby was there, but after a few scans it had stopped developing and its heartbeat had stopped, but obviously it turned out to be a molar and not a miscarriage. So yeah, that's a miscarriage. The next one is the molar pregnancy, which I'll put a link on here on this video so you can go and see the information on that one, because that was a longer video, and you'll get more information on that. It's basically a like chromosomal abnormality with either placenta and abnormal cells, or a baby that doesn't develop properly, and normally it can't develop past the first trimester. Sometimes they do. It's with a partial molar, which is horrible because they actually develop into a proper baby, and it can go up to like 20 weeks, which is not nice. And a molar pregnancy, you have complications and health problems afterwards, which I've explained, and this is why I'll move on to the next one in a minute. That's also like a health illness one. Yeah, the next one is ectopic. Most of the time ectopic pregnancies will be tubal, which means they're not viable. There's no baby. The egg won't develop. It implants in one of your tubes. Sometimes it can be it will be outside the womb still, but sometimes it will be in other parts of the body. Like it can be in like a cesarean scar and things, but so most of the time it is in the tube. And so yeah, the baby won't develop. So it's not a normal pregnancy. It's just an embryo that's stuck in the wrong place. So it's not classed as a normal pregnancy. That's why it's, classed as a tube or ectopic. Unless it's outside the tube, your belly won't grow. You'll still have some symptoms, but yeah, sure, because it's not implanted in your womb, your belly won't grow and your womb won't grow. So most of the time people don't even know they have ectopics until they do a test. And then obviously you have to have it removed, or as they call it sometimes, a medical abortion, which is not right, but that's what they call it, because obviously it can put your life in danger, ectopics, if not removed. So yeah, so this type of pregnancy is not viable and it will never develop into a baby. So ectopic happens 1 to 80 to 90 pregnancies in the UK, and is around 12,000 pregnancies a year. There's no way to save this pregnancy, and if it isn't removed, then it puts your health at risk. So you have to remove the embryo, and yeah, that's the type of, like they say, illness, disease, because it's life-threatening to you. So yeah, that's why they have to remove it. So as it can cause internal bleeding and obviously then lead to death. Symptoms are missed period, tummy pain, vaginal bleeding, pain in the tip of your shoulder, discomfort. Symptoms: the embryo has ruptured, a sharp, sudden pain in your tummy or inside, the pelvic area, dizzy, fainting, feeling sick and pale. This means it could have ruptured, which is life-threatening, so you need to go and get it removed. There are, in other cases, things that can increase your risk of ectopic is smoking or previously smoking, pelvic inflammatory disease, and history of ectopic pregnancies. It can mean you can have increased chance of an ectopic pregnancy again. There's 3 different types of things you can do. What they will do is either expectant management, they will wait and see. If you'll naturally miscarry, I think over half of the women will naturally miscarry an ectopic. Medication, they give you medication to miscarry, or surgeries, keyhole surgery, or I think is another one. The keyhole surgery is used to remove it, and sometimes the fallopian tube if it's too damaged, or sometimes the tube will rupture during the surgery, so they have to remove your fallopian tube anyway, which is in the long run better. So there's less chance of you having another ectopic in that tube, because it would have been damaged, most likely. Is why the baby implanted it in the first place. Ooh. Moving on to the next one is the second trimester miscarriage, which is normally 13 to the second trimester is 28 weeks, but I think a late miscarriage is classed before it's viable, and that's normally 24 weeks. And that is a second trimester miscarriage, and normally these are caused by chromosome abnormalities, cervical insufficiency, basically the cervix dilates, or there's a problem with it before when you're pregnant, not before you're pregnant, birth defects, placenta problems, or there's other factors. I think like your water's breaking, can be from infections, and it's like if you have a urine infection and it's undiagnosed, it carries on, it can actually lead to premature birth, which is the next one. Premature birth or delivery is when you basically go into labour before your term, and sometimes it can happen before the third trimester or in the second trimester, and it results in a pregnancy loss or other things that lead to the baby dying because of the premature delivery, because it's not developed properly, or the lungs are not developed, or say there was an infection. And most of the time, if the baby is born after like 23-24 weeks and it dies from being born too early, it's just not strong enough to survive, or that say there was a problem or something wrong with the baby as it was born, so that will end up with being classed as a premature, I think, loss or miscarriage. It's not classed as a miscarriage, I think, no more, but yes, it's classed as a pregnancy loss. So yeah, the last one is one of the worst ones, is a stillbirth. It's classed as a pregnancy loss, obviously, and basically the contributing factors can be infection, placental problems, birth defects, complications, high blood pressure, umbilical cord issues, medical complications. Basically, if the baby doesn't get enough oxygen, obviously it will end up dying. Sometimes they can die during labour because they don't get enough oxygen, because either the cord's wrapped around his neck or they're getting stuck as they're trying to get out. There's a lot of reasons and risk factors that can lead to a stillbirth, which is not nice. Obviously, as I've gone along, these have got more, say, serious and more, hurting wise for mums. I'm not saying earlier ones don't hurt, but I'm saying they do hurt more as you go along. The further you are, like a bigger baby, the more you've felt it kick and grow. If you've had to give birth to a baby and lost it, or say stillborn. So I am just trying to raise awareness. I don't want to upset anyone, because obviously I've gone through 2 of these myself. I've gone through early miscarriage and a molar pregnancy, and I was at risk of an ectopic because I have twins that run in my family, and I actually released 2 eggs, and one of my fallopian tubes was actually blocked. So I could have had an ectopic, or I could have actually had twins, which didn't happen, and that was in my molar anyway, so very likely I would have lost it even if it had been okay. But yeah, and if a baby dies before 28 days old, it's classed as a pregnancy loss, I think, as well. So yeah, there's a lot of different types of pregnancy loss and miscarriages, and I just wanted to raise awareness and tell people different types of them, because some people can be really ignorant or unintentionally hurtful. And all of these, they will hurt differently, but they all hurt. And say whether it's a complication from trying to get pregnant, or whether it's a pregnancy outside, then I just wanted to raise awareness and tell you symptoms and things so you can look out for them. Possibly save your life if you have like an illness like an ectopic pregnancy. Molar pregnancy, like I said, I'll link that, because they can be life-threatening, and most of the time are not viable, and your baby will end up being taken away from you, because the molar pregnancy does develop into a baby if they're partial ones or twin molars, which is not nice. I want to give support and things, and obviously where I've had the 2 losses, this is a part of me wants to spread awareness and but I also want to show that you can come from that and be better and happy and have a better future, even if you had a horrible past like what we had with our losses. Say, I've got my top on, I don't want to offend anyone with this, but say obviously I can't hide it anyway, this is our rainbow, and I hope and pray that anyone that's gone through a loss or any of these losses will go on to have a healthy baby in the future, and have a pregnancy in the future like I have and I am now, which I hope stays amazing and goes smoothly. So I hope I've told you different types of pregnancy losses that you didn't know about, and I hope I've raised awareness on it. And yeah, I hope this helped in some way. Thank you for watching this video.